Okay, so again, thank you all for joining us. I'm going to go ahead and get us started. Good afternoon or morning, depending on where you might be in the nation. My name is Melissa Cleater, and I am a program manager at the National Fund. And I am delighted to see so many folks joining us for this kickoff launch to an amazing series for CareerSTAT, the Frontline Focused Building Equitable and Thriving Workplaces. Can we jump? I'm going to go ahead and just jump to the next slide, if I may. So this is a preview of what we're going to cover today. I will give a very brief overview of the National Fund and CareerSTAT for folks who might be new to the network. And then Tom Strong, the National Fund's Director of Employer Activation, and a special guest appearance from Bashara Addison, who's the Director of Job Preparation for the Fund for Our Economic Future, which is a National Fund site in Northeast Ohio. We'll give some insight on why it's so challenging to fill positions and how intentionally creating equitable workplace can really give employers a competitive advantage. And then around 2 p.m., we are going to transition into optional breakout rooms. These are going to be self-directed and are really an opportunity for you to connect directly with peers on the line. So the National Fund supports a network of over 30 regional workforce collaboratives aligned around workforce equity. We like to think of ourselves as nationally powered and locally driven around these three big audacious goals: that workers have resources to thrive, that race does not dictate employment outcomes, and that all jobs are good jobs. And please note that is not any job is a good job. It is all jobs are good jobs. That's a key difference. And then we're going to slide in a way that we organize our work is around these 4 integrated solutions. Obviously, myself, Tom, and our colleague Claudio are on the Activate Employers team. And we work closely with our colleagues in Equip Workers for Success, Changing Systems, and Co-Investing for Impact to meet those goals and other goals that we have as the National Fund. CareerSTAT is a cornerstone of our Activate employer work. It is an employer-driven network based on peer exchange, created to increase the investment in the skills and careers of frontline healthcare workers. And just as a side note, when we're talking about frontline healthcare workers, I think there's a lot of ways that frontline workers can be used. We are talking specifically about those positions that require an associate's degree or less, or positions making less than $50,000 a year. So this includes many allied health patient-facing positions that are critical to building those nursing pipelines, but it also includes roles around transport, services, administrative services, EVS workers, and dietary services. And the National CareerSTAT Network has over 320 members in 38 states across the nation, and includes a range of healthcare employers across the continuum of care. So from big hospital, multi-facility systems to independent providers to community health centers to long-term care. And it also includes industry partnerships, workforce development partners, and philanthropic organizations. This is just a little level set for what are we doing here today? What is this series about? And ultimately, we really want to drive home the opportunity for you all to learn and share best practices for engaging untapped talent and addressing workforce challenges. The ability to connect with peers, it can be super validating and inspiring to hear what folks in other regions are doing to address challenges that you are also facing. And then we're also aiming to shift some mindsets and practices and approaches to meet this moment that we're in. The US healthcare system has been under enormous pressure for the last few years. Previous and long-term workforce development challenges only exacerbated by high-risk situations, grief, trauma, and burnout. And the need for immediate action to address the staffing crisis is great, but the reality is that we also have systemic problems that need systemic solutions, and we need to come together to find those solutions. And it helps me to think about what are the things that are in our realm of control now and that we can start working on, and also identifying some of those longer term strategies that we can start working on now so that we can create lasting change. I encourage folks throughout this session and throughout the series to be curious. There may be times when some data or language that we use kind of makes you go, and I encourage you to think about and connect to that reaction that you might be having. And if you're comfortable, you are welcome to share it. We see this as a very collaborative environment. These problems that we're going to be talking about were not created individually, and we can't solve them individually. And you all bring very important and valuable expertise in this space, and you are encouraged to share it. And so whether that's through the chat, whether it's through the Q&A portion of the presentation, or it's in the breakout rooms afterwards, I hope you're ready to be engaged in this space, because we are looking for you to be engaged in this space. So in the spirit of creating a little community within the Zoom room, I would love it if y'all could drop your names, organizations, and location in the chat so we can see who we're sharing this virtual space with today. And as you do that, I'm going to turn it over to Tom to dig into what I've been referring to as the good stuff. So please, Tom, take it away.
Thanks, Melissa, and good afternoon, everyone. It's great to see y'all today. I'm going to launch this section by just asking a real simple question, which is, why can't we all fill our open positions? What has gotten to be so challenging about that? We at the National Fund have been doing some new research on this question that we hope will be illuminating today. And our hope is that this will be an effective launching point for the rest of the series, that it will frame discussions about how best to approach your talent, recruitment and retention strategies, and help you understand the labor market that we are working in today and will probably be working in for the foreseeable future. So an overarching picture of this labor market can be seen in this chart. This is a chart that shows the number of unemployed persons per job opening in the United States from the US Bureau of Labor Statistics. What you can see here is that there are currently almost 2 job openings per unemployed person. And that represents a long-term trend that has been going on for years. That number keeps on shrinking, or if you want to flip it, the number of job openings per person who are unemployed keeps increasing. And there was a massive blip in this, as you can see, that was due to the COVID crisis. But at least in this respect, COVID did not change the overarching trend. What we see kind of happening before COVID and happening after is a clear continuation. And it's really driven by long-term demographics in the US. What this all means is that job seekers in the United States have more choices when it comes to where they want to work than they have had in decades. And employers who want to figure out how to be competitive in this job market, first and foremost, I would say it's crucial to understand that. But to put a different light on it, let's dive into what this looks like from an individual community standpoint. And for this first time sharing this data, we chose the city of Cincinnati, Ohio. So if Cincinnati's working age adults, if you imagine them as just 100 people, what does that labor market look like right now? Well, 74 of those 100 people are already employed. So automatically, if you're thinking about who you can hire, it doesn't mean that those people are unavailable to you, but there's additional hoops that you may need to consider. Of the 26 who are remaining, about 20 of those people are not currently looking for work. And we'll have a lot more to share about what's going on in that decision for them as this presentation continues. So that right there leaves 6 adults who are unemployed and looking for work in Cincinnati, Ohio. Let's share a little bit about these 6 adults. One of them does not have a high school diploma. 2 more of them have a criminal record. and at least one of them has a disability. Now, we know that there's a lot of great work happening through CareerSTAT and through the National Fund Network about addressing these primary barriers to work. And so in the past, we would have assumed that, in our calculations, like we would take these people out, but we know that's not the case anymore, that most of you are trying to figure out how to create excellent second chance programs, that you're doing your utmost to accommodate disabilities as best you can. In healthcare, obviously, high school diplomas can be a trickier thing. Education and credentialing is super important in the healthcare system. But we'll say for now that we're down to about 4 or 5 high school graduates who are unemployed and looking for work that are still in your talent pool. So wait a second. Does your industry have a gender gap? Well, healthcare definitely does, right? So right there, you can cut your talent pool by another 40%. So that leaves 3 out of 100, 3 adults in Cincinnati, Ohio, who are unemployed, looking for work, and likely to be approachable with your talent strategy as it stands. And again, this assumes that you are doing the things to address second chance hiring, that you're working to accommodate disability as best as you can in the workforce. If you're not doing those things yet, then you're already playing catch up because you're down to 2 or 1 or 0 people instead of 3 here. Now, a lot of employers will look at this scenario and say, okay, well, what we'll focus on is young people, right? Young people are the future. They will help us grow our workforce over time. And unfortunately, like that's an important thing to do, but it's going to be really limited for you. High school seniors in this scenario add 2 people to the labor force every year, and one of them is going to enroll in post-secondary education. Long-term, that's great for healthcare. Again, healthcare is a field that really values and emphasizes education, but it delays things, right? The number of people you can hire is still pretty limited from that organic growth. Doesn't mean it's not important, but it's not going to solve the bigger problem. So this is troubling, of course, and a lot of employers will look at this and be like, oh, well, what about the future? Is the labor market just going to change? What if there's a recession? Maybe that'll like loosen up the labor market some and we can be more competitive. There again, I don't know if I can share particularly good news, honestly. There's a really fascinating labor market outlook report by the Burning Glass Institute that just came out earlier this month. And a couple of the conclusions that they share is because the labor market is so historically tight, should the economy move into a recession, there are going to be layoffs, sure, but we expect the number of layoffs to be relatively modest. And ultimately, they see the increasingly tight labor pool that we have in the US as constraining economic growth in the US, that the only way for the economy to continue growing at a healthy pace, and it has, of course, been growing well lately, but the only way for it to grow at a healthy pace is for the labor pool to grow, and current trends make that highly unlikely. Now, does anyone have some ideas about what specific current trends are making that unlikely? I'll share 2, and we'll get back to these in a bit. 1, population growth is slow in the US as it is in most developed countries. And 2, the number of documented immigrants that are allowed into the US every year has gone substantially down over the last 10 years. It's still our largest source of population growth. But as a result of these 2 factors and the fact that we can't, as a society, agree about how to handle them, that is a major limiting factor in our economy. So that's a lot of depressing data, right? And it is. It's a challenge that we're all going to have to deal with, and we may have to be dealing with for some time. And so you're naturally going to ask, what do I need to do in my role, in my health system, or in my workforce collaborative? What we will say, and what the rest of this presentation will focus on, is think about how you can create long-term value for your organization, for your employees, and for your community as a business strategy, not just as an initiative or as a program. It's not that initiatives and programs don't matter. They're really important. They're the core of what we do in workforce development. But a business, an organization, an employer that's going to thrive in this scenario is going to be one that has a whole-scale strategy for addressing it and providing a great place to work that is an employer of choice in their region. And that leads into our next section, which is what does it mean to create an equitable workplace? And what kinds of things do we have to do? So first of all, kind of thinking back on the data I shared, focusing solely on the unemployed with a high school diploma, again, it's going to be too limiting. High school students will help. I know most, if not all of you are probably working on that, but it's not sufficiently going to expand your talent pool. Demographic trends are not in favor of a massive change. So we need to be, as employers, thinking about larger pools, about more fruitful gardens to tend. And so we want to talk about where you should be focusing your efforts on recruitment and retention. And we think the key is to focus on populations where substantial growth is possible for an organization. And there's 3 key populations here. There's the underemployed, people who fundamentally don't want a better job than they have now. There are immigrants and refugees who are the main source of population growth in the US. And there are people who've become more marginally attached to the workforce. Those people who have withdrawn from it, the 20, especially after COVID, but have an interest in coming back. Success with all of these populations is going to require a strategy that's centered on equity and inclusion. And it means understanding the social determinants of work. And some of you may be thinking this as I say that. Especially if you're in healthcare, you're probably used to thinking about the social determinants of health. And I'd like to bring Melissa back to discuss what we mean when we say social determinants of work.
Yes, thank you, Tom. And, my sense is that many of you are very familiar with social determinants of health. I imagine that is a part of your organizational goals, population health. And I would love if you could just dip into the chat and just what are some of those elements when you are thinking about social determinants of health? What are some elements that may also apply to health? To workers that could also apply to workers. So whether you want to put it in the chat or unmute yourself, this is a casual space where we encourage folks to be a part of our thinking and we want to hear from you. And so looking at some of the things coming through the chat, housing, education, transportation, childcare, caregiving more broadly. Caregiving, again, that infrastructure is so critical. People can't come to work if they are caring for other people, whether that's children or their parents or other loved ones. Wages, chronic illness that limit activities, an income gap. I told you all you were smart. I told you. Wait till you see this next slide. Education, trauma. All right, I think that's a great to get us started. So let's kick it to the next slide and see what other things are out there, right? So we know that these social determinants are impacts for both job seekers and for their employers. And these barriers include many of the things that came up through the chat. And these are often many systemic barriers that need support to be solved, but are really challenging and often intentionally challenging to address. They are intentionally complicated because they maintain a certain level of power and control. And then within this, there is, especially for frontline workers, burnout, low morale have been significant. Folks aren't trusting. And I think when we think about that moment that we had for essential workers, we were opening our windows and praising them and hitting pots and pans for about 2 minutes, right? And then after that, it was like, oh, we are going to need y'all to go back to those things because I want to live my life again. And a lot of frontline workers across industries were really put in exposed risk and also bore the brunt of losing colleagues and family members and all of those other things associated with the challenges that go with a broad scope of a large grief event and a large disability event, right? So I think that's my spiel on this. Tom, what do we got next? Is this me or you?
This is still you, but just
okay.
Yeah.
Thank you. So again, when we have the pre-pandemic trends, we had challenges pre-pandemic, right? There is certain positions that were perpetually difficult to get placed. They were hard to recruit and maintain the training and credentialing that's needed for those. It posed a lot of challenges. And then now at the back end of the pandemic, which is still ongoing and still happening, there are at least 3.5 million fewer workers. There is at least 400,000 people of working age who have died because of COVID. There are over 2 million older workers who retired earlier than we thought they were going to. And women disproportionately left the workforce or gone to part-time roles, largely in part to that lack of solid childcare infrastructure, and who was made responsible for filling that gap once schools and other daycare facilities were closed. And then, as Tom mentioned, the number of immigrants and new Americans coming into the country is much less than we had previously expected.
So I'm going to take a deeper dive into the groups of populations, the groups of workers that we think need to be kind of the primary focus here. But Melissa and in the chat, Bashara kind of highlighted a key aspect that I want to take into this, which is that these are groups of workers that have experienced trauma in different ways. Most of us here work in or work with healthcare institutions, so we understand trauma, especially from that medical lens. Part of our perspective here at the National Fund is that there's also a trauma lens that applies to workforce and the work experience. And we need to be thinking about that trauma lens when we are thinking about our strategies for building a thriving workplace in this context. So the first of the populations I mentioned are the underemployed. I want to take a deeper dive with them. There are multiple definitions of the underemployed. From a healthcare perspective, the most relevant one may be people who are underemployed if they have a higher level of educational attainment than that is required by their job. And in Cincinnati, Ohio, roughly half the workforce is underemployed by that definition. There are other definitions that have more to do with income attainment. In that case, it's a somewhat smaller portion, but it's still at least 30%. It is a huge pool of the workforce, in other words. And it's an area where, as employers, we want to figure out how to be competitive. But being competitive with the underemployed means having an equity inclusion lens that you apply to your whole organization, the entire organization. So for example, again, in Cincinnati, Black people, especially Black women, are substantially more likely to be underemployed than white people. You can see the numbers here. This is a perpetual issue in our society. And if you add in kind of unemployment differentials as well, the number comes closer to 2 to 1 rather than kind of the 1.5 or 1.25 to 1 you see here. Immigrants, another key population that we're thinking about in terms of growth. Even with a recent slowdown, immigration is projected to account for 75 to 88% of future population in the US through 2065. It is the main way that our population is growing. If you think back to that slide about high schoolers, basically we have 3 immigrants or 4 immigrants entering the workforce for every high schooler. And so that needs to be a critical part of your strategy. And as healthcare organizations who are often treating immigrant communities as well, we know that you're thinking about that carefully. There's one other group, which is those who've become more marginally attached to the workforce. And for that, I would like to zoom to the other corner of Ohio in the Northeast and bring Bashara Addison, the Fund for Our Economic Futures Director of Job Preparation, to speak to their research on that topic. Bashara, welcome.
Right. Yes, Tom, thank you. And I've actually seen some of your slides, and I feel like you added more since I last saw this presentation, and I'm taking rigorous notes. I'm wow, that's really great. We've got to figure out how to turn the research I'm going to talk about today into some of those kinds of slides for Northeast Ohio. So thank you for the introduction. I work for the Fund for Economic Future. We're a civic collaborative in Northeast Ohio. Civic collaborative means that we have funders, we have philanthropy. We actually have a long-term care organization that's also a member. And the thing is, we want to focus on strategy that helps us achieve equitable economic growth. And what I'll talk about today is a major initiative that we embarked on with some partners in Northeast Ohio, in particular Team Neo, which is part of Jobs Ohio. It's our business attraction entity for the state. The Summit County Workforce Board, Connexus NEO, which is an intermediary that has a healthcare sector partnership, and they're based in Summit County, Akron, and then Policy Bridge, which is a Black-led think tank in Cleveland, worked together over the last year in 2022 to really better understand this question of where are the workers? We kept getting this question and we're like, we've got to figure out what is going on here. And so it's a massive survey, and I'll put a link in the chat to some more of our findings, but I'm going to give you a snapshot today. You can go to the next slide. All right. So I'll start off with, if it feels like the labor market is tight, it's because it is tight. When we looked at data through this survey in 2021, there were 95,510 fewer people in 2019 relative to 2021. That's a 5% decline in the number of people employed since the start of the pandemic. We have individuals that have started new plans. Over 400,000 Northeast Ohioans said that through the survey that the pandemic caused them to change their career plans. You have more individuals working remotely. 27% of workers work fully or mostly from home, and 41% of those started since the pandemic. And we also had more people working multiple jobs. About 48% of the people that responded to our survey were working 2 jobs, started doing so since the pandemic. And as it relates to kind of the gig economy in particular, people said that they really enjoyed that work. So these are really stark results that people have different attitudes and behaviors about work, at least those who responded to our survey in Northeast Ohio. Next slide. We also know that people are planning to quit, and they're going to keep quitting. This particular slide looks at those who responded to the survey that indicated that they were planning to quit or have quit within the past year. So this is looking at 2021 through 2022. And we were able to break it down by industry. You'll see I have 2 areas circled because that's specific to healthcare. And what I think is interesting for those that had planned quits, one, there are people who are quitting without a job lined up. That means they don't have a plan, they don't know what their income is going to be, but they're still quitting anyway. But we also found, if you look on the right-hand side, that there are folks who are planning to quit, but something could be done to be able to keep them in the workforce. And so we'll talk a little bit more about what those things are. If we go to the next slide. One of the challenges that people are facing, and I think this ties into the slide that Tom and Melissa have around the social determinants of work. There are barriers to work that individuals expressed in the survey, and those included pay being too low to support their family, having health issues, disabilities, health concerns, transportation issues. I know in Summit County, which is the municipality that anchors Summit County is Akron, they were struggling with transportation, not just because people didn't have enough transportation to get to work. So like we don't have enough public transit infrastructure. Public transportation as a whole is struggling to find talent too. They're facing a labor shortage. And so the ability to be able to like actually staff public transit has been challenged. So there's transportation that individuals are feeling, but the industry itself is also feeling this tight labor market. Criminal records can be a barrier. Vaccine mandates, both people insisting that there be a vaccine mandate, that like they go to the workplace and they want everyone to be vaccinated, and those who are rejecting workplaces because there's a vaccine mandate. So we saw varying opinions, but it all tied into people have differing positions on vaccine mandates. Childcare issues came up, lack of work experience, not having a high school diploma or GED, and then also the lack of training. And we were able to break that down by income. And so when we look at this, we can also look at this data by generation. And we found that Gen Z in particular was more likely to need and seek more training, but they were less aware of available training in Northeast Ohio. If you can go to the next slide. We also ask questions around what is really important for folks when it comes to work. And to no surprise, we're able to break this down by race, but we can, if you go to our website, you can see that we can break this down even further by demographic and income. But wages showed up at the top, no surprise. Flexibility, opportunities for career advancement, and Gen Z is a particular group that is interested in this. Meaningful work, paid time off, medical and dental benefits, retirement planning, and accessible and affordable childcare. Of note, these were questions that were open-ended when we surveyed our region. And so individuals came up with these responses on their own. And so these just happened to be these ranked as what was highest in terms of what folks were prioritizing about what was very important for them as it relates to work. Next slide. We also did focus groups, and one of the quotes that we have is, "All money is not good money." We know that wages and benefits can attract, but culture also decides whether people will stay. You can call it bad management or discrimination or toxic work environment, but we found that 1 in 5 people who are planning to quit their jobs, the #1 reason cited for either quitting or planning to quit had to do with toxic work environment. And that was also an open-ended question. So we had a tagging system that really looked at that. And so when people are self-disclosing that work environment is one of the most important reasons why they're willing to stay or go, that means that there is something employers can do, but it really centers on workplace culture. Next slide. We also wanted to look at how people were feeling about work. There's definitely a range. But you'll notice in the healthcare sector in particular, because this slide is broken down by industry, that people are experiencing more stress at work since the pandemic. And healthcare in particular was seeing a spike, healthcare and education, in terms of how people were feeling in the workplace. We also know that for half of all women with children under 5 say that childcare issues were an extreme or moderate barrier. About 1 in 4 Northeast Ohioans said that they needed more training and education to get ahead. So that's more than just Gen Z. And that Gen Z in particular said that they were less satisfied with their current work environment. They were more likely to not make enough to make ends meet. And it was more difficult for them to find employment and have more stress at work, and also call in sick due to burnout. And so when Tom was describing, this effort to really capture high school students and really that Gen Z group that's coming into the workforce, they are having some specific issues as it relates to burnout, finding employment, and making enough money, and then also really being comfortable and feeling included in their workplace. Next slide. And this is one of our last slides, but I'm going to put the link in the chat again so you can see more of this information. What we were able to gauge across this monumental body of research is that there really are 10 ways that you can become an employer of choice. And that is paying a competitive wage, those are table stakes, including pay in all job postings. Just a personal example, we're hiring at the Fund for Economic Future. And the position that we're hiring for right now was actually a position we posted last year, but we didn't include a wage band because, we want to negotiate based on experience and credentials. Based on this survey, where we're like, we can't, be true to the survey results if we don't model the behavior we want other people to have. So we put a wage band in our job posting. And I got to tell you, my phone is still blowing up with individuals who want to talk about this job. Almost the same position that was posted last year, but one big difference is that we communicated benefits clearly. We thought about beyond traditional benefits because we know that we're trying to attract different kinds of individuals to our workplace. And the wage band really did matter. We also want to make sure that people are evaluating and improving employee feedback, incorporating flexibility where possible, addressing work culture, investing in employee career development, and also connecting to systemic efforts to support workers. I don't think anybody expects employers to change all systems. That would be a lot to ask. But there are things that employers can do, such as engaging in sector partnerships and looking at who's attending the webinar. Many of you are either working in or leading a sector partnership yourself. And so actually helping employers connect to that work is one of the ways in which employers can become an employer of choice. And if I'll leave with a quote from my boss at the Fund for Economic Future, our president, Bethia Burke, she always says, it's never a competitive advantage to have a bad workplace. And so thinking through how you can improve work culture might make a difference between whether an employee stays or goes or comes to work for you. And so though that's what we were able to gauge in this massive survey. We surveyed over 5,000 residents in Northeast Ohio, and that's important because of statistical significance. We can generalize findings as a result of that. Massive undertaking, but definitely yielded some of what you already know, but we can validate your hunches with this research. So hopefully this is useful, and I'll put links in the chat. Thanks, Tom.
Awesome. Thank you, Bashara. And folks, I know we're sharing a ton of data with you right now. If you have questions, please feel free to go ahead and ask. In the chat, we will have time for Q&A at the end, in person as well. So Bashara has gotten into kind of what we see as one of the main takeaways of this, which is how do you become an employer of choice in this environment? And the way we think about that at the National Fund is actually designing a value proposition for your current and your future workforce. I'm going to take you through the way that we think about that. I want to start by opening up, because we're going to use a term that sometimes we find takes employers aback a little bit, which is job quality. We talk about job quality a lot at the National Fund. We think that, as Melissa said at the beginning, like we want to see a future where all jobs are good jobs, where everyone can thrive in the job and the career that they choose. But we recognize that job quality can be a tricky thing to define, that a good job for one person may not be a good job for another. And ultimately, it's about the match between the person, the job, and the career they're trying to develop. But in general, the kind of investment, the more investments that employers make in job quality, the better their odds of attracting and retaining the best workers for them. And we at the National Fund like to think of job quality the same way you might think of service quality to your patients, or the way a manufacturer may think about product quality. It's not an endpoint. It is a process for continually improving, refining your offerings. And we really do encourage you to think like an entrepreneur, to think like a business when you think about designing your jobs. In workforce, most of us here, I think, either in a healthcare institution or not, like we tend to think about workforce issues through a workforce lens. And that often leads us to think about the skills gap and how we upskill workers. That still matters. Skill will always be an important issue in workforce development. But one thing we want you to take away is that in many ways, that is yesterday's problem. That is yesterday's problem. Today's problem is that the people choosing where to work have more choices, and the employers reaching out to them are often selling products they don't want. They are selling jobs that fall short of the goals and the aspirations of the people who want to fill those jobs. A lot of employers will also say, well, people just don't want to work. Well, employers have been saying that for literally hundreds of years. It's not true now, and it wasn't true then. People do want to work, but they want to be valued, and they need a new value proposition at work. And so we actually have an exercise for y'all to fill out. And we'll share these slides. And this is something you can do in between sessions in the series. But we would like you to think about, what is your value proposition for your employees? And you can choose, especially if you're in a larger institution, you can choose a specific class of workers, maybe one that's been kind of difficult to fill. So what is your value proposition for medical assistants, or your value proposition for nursing aides? Just this real simple little flowchart exercise, but think about how your approach to job design helps this group of customers who want to achieve something, and how it differentiates you from your competitors in the market. We are very much encouraging you to think about the market and how your strategies will differentiate yourself. And we're going to share a few tools and a few resources for thinking about this value proposition. So one thing is there's a separate body of research. We don't have time to get in the weeds with it today, but we may feature it at a future session that we developed at the National Fund called our Job Quality Outcome Maps. And what this tool is we looked at 50 years worth of organizational science studies that examine the relationship between the job design choices that employers make and the outcomes for those employers. And what we found is that over 50 years, there were some pretty consistent findings for certain kinds of outcomes. So one outcome was turnover intention, which is when an employee says, kind of like the questions Bashara was sharing, I plan to leave this job in the next 6 months. Our job quality maps found these practices, these job design choices, all positively impacted employee turnover and turnover intention. So their satisfaction with their compensation and benefits, their opportunities for training, development, advancement, their perceived support, which was actually a key one across all of the business outcomes we saw, their worker voice, their voice in the workplace, if they're a unionized workplace, their representation, their formalized HR practices in the organization, the clarity and the stress associated with their role, again, kind of getting to the issue of burnout and toxic stress, their autonomy, their independence, their level of control over their own job. Micromanagement is very bad for turnover intention, just for the record, and their perceived job security. All of these have I can't say they're causal, but they are strongly associated with improved turnover intention. Another tool we have is our job design framework, which some of you may have seen before. This is our way of describing the things that people value at work. And we use this tool to help employers and help our other partners understand that quality improvement process for work. So it is a way of choosing. You don't have to do everything on our job design framework all at once, but it's a way of choosing where you can make improvements, what best suits your organization and your employees' needs. And it is built around the same equity and inclusion lens that we are focusing this presentation with. This is a summary of what our job design framework looks like. There is a much more detailed version on our website, and if we have time at the end, I can share that. But we start with a frame of racial equity and inclusion. Again, because there are so many disparities in the workforce, we think it is essential to start there. Within that frame, we have 4 pillars where you basically represent kind of bigger areas to think about the elements associated with a thriving workplace. And there's the core elements. Bashara spoke to many of those. Those include things like compensation, work environment, and your quality of your supervision. Those, again, are the table stakes. There's a level of support, and that if you're in workforce development, this is probably where you start, your responsibilities start, right? So it's training, internal assistance programs, such as an EAP, and external supports, which might be training for supervisors, for instance, or helping people access public benefits. Then there's the opportunity pillar, which is all about how you help people advance their careers and get into the kind of work that they ultimately want to get into. And that can include training again, but it can also include mentoring and coaching. It includes how people are respected and given kind of good feedback and positive encouragement on the job. And then finally, there's voice, which I'm going to spend a little bit more time on today, because this is one that is new. And I think in healthcare especially, I think there are ways to address voice that we want to be thinking about as a network. And voice is where employees feel empowered, they feel engaged, and they have agency within their work. And I want to kind of just zoom into the voice pillar a bit more, because as you may have heard from Bashara and from our other data, we think it's kind of a key piece of where employers can make further improvement. We see 3 stages within the voice pillar for employers to address. First is basic engagement. So you can't manage something that you don't measure, right? If you are in an organization where you're not currently measuring employee engagement, employee satisfaction, and how employees kind of think their job matters, again, that was something else that Bashara brought up in her data, you won't be able to figure out like how to address those problems if your employees are seeing problems there. Then there's improvement of the workplace itself. And this is an area where I think healthcare has made great strides. Many healthcare organizations now implement Toyota-style lean process improvement. We're all working on getting better, but it's an expanding process within the healthcare world. Creating continuous improvement processes that are inclusive to frontline workers is the key thing here. And how you kind of create organizational change that they can participate in and ultimately have a voice in is where we see a kind of a big opportunity. And finally, there's participation, like how kind of getting to the autonomy and control people feel within their roles. Healthcare is very necessarily like a hierarchical organization type. And that's about quality control. That's making sure that patients get the care they need. That organization needs to exist within healthcare. But we've found that organizations that try to maximize people's autonomy within their roles are often much more successful at retaining people and maximizing engagement and voice. And we do talk increasingly at the National Fund about worker voice. Worker voice is something where we want to kind of understand and expand the extent to which frontline employees can influence their workplace and their experience at work. The core elements of worker voice are representation, which does not have to be unionization, but it often can occur that way. Empowerment, agency, and value. When these elements are working together in the workplace, and people feel like they have some level of agency, they're able to grow their autonomy, they're able to know that they're going to be heard when they have concerns or they have grievances. We find that workplaces are ultimately much healthier and able to address challenges, especially with folks who have experienced trauma in the workplace or in the labor market in their past. So I'm going to pause here. We've got officially 10 more minutes of presentation time. We can go deeper into some of these topics, but at this point, we would like to welcome your questions before we go into breakout rooms. Feel free to ask questions in the chat or unmute yourself. As Melissa said, this is a casual space.
Can you go back to the slide you were just on about voice?
Yes.
I find this slide to be just very interesting in general, thinking of like worker voice, because I feel like what you were speaking to is more like HR and how HR kind of empowers and supports our workforce. But I know I know in a lot of the programming that we do, we also have to kind of take off our HR hat sometimes and be like, you know, an advocate or support the folks going through our program. So I'm curious if you could maybe just expand a bit on like the differences of how we support through like a programming lens as opposed to like our workforce development or like HR lens, and if there is that difference.
That's a good question. I'm actually going to go back to the previous slide. So part of, and this is clear on the original job design framework graphic that Melissa linked to, part of how we see worker voice occurring within the workplace is that it starts with employee listening, right? And that's kind of where your HR role is most clear. So if you have a space for employees to give feedback, if you have a transparent and effective grievance process for them to express concerns, and if you have ways to kind of really understand what are their barriers to engagement in the workplace, that's where voice begins. But ultimately, we think voice develops in organizations to the point where it can help shape, maybe not the entire workplace, but at least individual programs. So if you're launching a like a training program for new phlebotomists, and you're finding that you've got good results, but maybe the results could be better. And you start interviewing participants who've struggled in the program to understand what their challenges have been. And they share with you that transportation is a big barrier for them to success in the program. And you address that barrier, then that's taken their level of employee voice from just being able to provide feedback to actually helping to shape how the program works. And you in turn can evaluate if that intervention was effective. Does that make sense?
It does, yes. Thank you, Tom.
Are there other aspects of your question that didn't get to?
No, not really. I feel like it definitely helps. I'm just thinking from the perspective of some other folks on the line that are like newer to workforce development and just trying to navigate ways that we can empower and advocate for our program in a way that doesn't feel like it like crosses the HR boundaries. And I know with some of the stuff you mentioned, like worker fatigue, and then a lot of the, you know, SDOH implications as well, it's very important that we're able to be there for our employees. So yeah, it does. Yeah, thank you.
Okay, I appreciate that.
And Brianna, I'm going to jump in because one of the things that your question makes me think of is that in many healthcare systems, the work is very siloed, even though the goals are the same, right? And that's like a fundamental place within your organizational structure to be like, wait a minute, is HR connecting? Like, is that where your workforce development is housed, or is it in your community outreach and your DEI initiatives? If it's housed in different places, are they not connecting with each other? Are we not having quarterly meetings of leadership across departments coming together to say, our goal is local hire? How are we working together across systems? Are we braiding our funding and outreach? Or how are we doing, are we using the same language, the same opportunities? Are we communicating with each other? So certainly healthcare is not the only sector that has challenges with internal communication. But I think I've seen from a historical perspective, some of that talent acquisition to recruiters to education and training have been very siloed and not connected to one another. And it seems to bring a lot of missed opportunity, if nothing else, and a lot of recreating the work as opposed to like spreading the message. So I think that there's an underlying nugget that I hear in that question that just brings me to that if one of like the great things that I've done with some folks in CareerSTAT is just sit in a room and be like, what's your organizational structure? Where are folks housed? How is it? What does that look like? And just so you have some ideas around how that's working in other institutions, where you might have opportunities to change that. And even if you don't change your kind of structure, how might you be able to engage in different ways? And how might you be able to bring some of those leaders together so that they can, again, have these group conversations to solve some of these kind of systemic and continuing problems that are interconnected, right? When we talk about our solutions being integrated, it's because they're really too messy to pull apart. And in my mind, it fascinates me that, you know, that I understand the mode of the work is different, but if you don't have your recruiters engaged in, and they don't know about your talent development programs or your career opportunities, that feels like a real big missed opportunity. That could be easily solved, maybe not easily solved. I don't know, but you know, I think that it could be recognized, right?
No, yeah, okay, that was perfect. I totally agree. And we have a phone call, I think, next week. So more to come on that, Melissa. I'm looking forward to it. This will be great. Thank you for saying what you said.
Absolutely. And for the record, Brianna wasn't a plant, but just to say that if other folks want to connect, there are many opportunities to do so. All right, I'm looking for the chat. We just have a few more minutes. If there are any other questions or points of interest, if there was just a nugget that was like, ooh, that hit me, that resonated, I'd love to hear that as well. You will also see in the chat that link to the more in-depth job design framework. I also put in a link to an evaluation. Surprise, surprise, there's more work for y'all to do because we want to hear from you. We want to make sure that this is useful to you, a valuable use of your time. Some additional ways to keep the conversation is that we have a CareerSTAT mobilized group. This is specific for folks who do direct healthcare employers, right, who work in healthcare settings. But this is an online community. It's similar to social networking vibes, and it's a way for you to engage with one another. So if you have this immediate question that you're like, it would be really great to just get some insight of like, how are other people approaching kind of removing barriers for people with criminal records? This is a great place to do that. It's also a great place to continue this conversation. Like, how are you making the case to leaders? Like, I feel like this is really important, but I haven't been able to get the light bulb moment for my leaders to see this. So we are having an onboarding webinar in April, and I am going to find my link here to share in the chat. So this is if you're unfamiliar with it and you're just interested in hearing about how to get connected in that platform, what you might be able to share, what you might be able to learn. This is a great opportunity. My colleague Claudio is going to lead it, and they are great and fantastic. And I strongly encourage you to attend that. And then what's my next slide? Oh, it's a preview for the next session. How exciting. So the next session, we are going to be engaging with our colleagues at Upwardly Global, and they are going to be giving us some insights specifically on how to navigate some of the challenges around relicensing, particularly for immigrant and refugee healthcare workers. So if you haven't signed up for that, you can. I think that didn't work. I'm going to give me a second to give you an actual link in the chat. But we encourage you to share that. And again, these webinars are open to all CareerSTAT members. So if you have more colleagues in your organization that are looking for some professional development, because I'll also note that oftentimes in workforce, we don't have a ton of opportunities to develop ourselves. We don't have a lot of opportunities to get that professional development. And these webinars are no cost. They're a great way to get more folks in your organization who you're looking to collaborate with to be engaged and to get their brains kind of energized and starting to think about how y'all might be able to come together. So I encourage you to share that. And then we have these peer learning breakouts. And I'm going to be honest with you. This is an experiment. We haven't done something like this before. So we're going to see how it goes. But really, what we are looking for is that we have heard from our CareerSTAT members time again that there is just such a high value in being able to create some space for folks to talk to one another, just to hear what other people are doing, what they're thinking about, ask for tools and resources for some immediate challenges that you might be facing. So from this point, at 2, we're going to go into breakout rooms if y'all want to stay. If y'all have competing priorities and feel like you've tapped out on what you can do today, that is okay. We will have this opportunity in future webinars as well. But we are going to assign some rooms, and they're going to be really self-directed. So a lot of your engagement with CareerSTAT is led by you. It's about what's important to you and what would be the most valuable conversation for you to have. So I encourage you to start the conversation by introducing yourself, your name, your organization, and then just start. And these are some sample questions, but they certainly don't have to be these questions if there are other things that are on top of mind for you. Fair warning, we won't be in the rooms at the start. So if you're looking for me or Tom or Claudia to come in and start the conversation, you're going to be waiting because it is self-directed by you all. So we really want you to take this time to make it your own and not influence you because, you know, I'm a bit bossy. So we want to create a little bit of space for you all to decide what works for you. Okay. And then I think one last thing, if you're not able to do the breakout rooms, we have just one last slide of just resources from the National Fund and from of our partners. This will be included in the deck that's going to be sent out. And this is just on your own journey. If you want to take a deeper dive into some of these resources, we are absolutely going to be talking about some of them in future sessions, but no reason to gatekeep the resources. Echo. Okay. So now I think we are ready for breakout rooms.